in healthcare, we're just trying to be consistent in our messaging. Like we've talked about before, I think the individuals who really wanted to get vaccinated have been vaccinated, and that's great. And I'm hopeful that a couple of things, well, one thing will drive more vaccine, and that is full FDA approval. So we're hopeful that the FDA will, in late July, early August, fully approve the Pfizer product and then move to the other products. I think there is a segment of the population who's unvaccinated that's waiting for that full FDA approval. So I'm hopeful when that happens, some more people will get vaccinated. But as we know, there are other individuals who are very against vaccination and don't want to get it. What I hope doesn't happen, and I think it will in some places, is that the only way some individuals will be motivated to get vaccinated is if they have a personal tragedy. They have a friend or family member who gets the Delta variant and has a bad outcome from that. They're hospitalized or they die, heaven forbid, and that will prompt them to get vaccinated. We see those stories. You see those, out there in the press where someone says, "Well, I wasn't going to get vaccinated, and then I was personally affected by this." I hope it doesn't take that for some communities to take it seriously and get vaccinated, but I fear that it's going to. When the human body interacts with a virus like this from a respiratory tract, it's a lot about the interaction between the virus itself and the cells in your airway. And this virus more efficiently binds to those cells and then enters those cells and may in some ways elude the immune system more effectively. So when they say, hey, this Delta variant is 50% more contagious or 55% more contagious, that's what they're referring to, is that interaction between the virus and your cells. And it's more likely to be able to get into your cells than maybe some other versions of COVID. And because of that, it becomes more contagious. So if you get exposed to it, you're more likely to develop a case of it. And, when that happens, it's going to run through parts of our community that are less vaccinated. That's just what's going to happen. And so I think what we're going to have is these pockets of cases. You're going to hear about a community where cases are up here or up here. And we've seen that in Missouri and other parts of the country. Places that didn't have a lot of natural immunity because they didn't have a lot of cases earlier in the pandemic, and the vaccination rates are low. And then the virus is there, it's highly contagious, people are vulnerable there. Sometimes in those communities, a lot of other comorbidities are there. And then you have a whole situation on your hands where you have a lot more cases, a lot more hospitalizations, and potentially more deaths, depending on where you are. So I think it's these kind of fires we're going to be trying to put out, repeatedly as we go through the summer into the fall. And, the hope is that people in those communities will get vaccinated. And so the fires will just kind of be smoldering embers instead of wildfires. But that may be what we're dealing with for a number of months here.